Hey, what's going on, everyone? So after getting some questions and comments about when it's appropriate to get a cortisone injection, so I want to do a quick video here, a little longer than before, just talking about if a cortisone injection might be for you. So just to review the three main reasons or topics I talked about for potentially getting a cortisone injection. One is diagnostic, okay? So for the example I'm going to use is for hip pain. And so nowadays a lot of docs are using the cortisone injection as a diagnostic tool to differentiate if your pain is truly originating from your hip joint or is it potentially being referred from your back. And it tends to be a pretty good tool in diagnosing the source of the pain. So that's one reason. Reason number two would be if you were just in a really flared up kind of acute inflammatory reaction state, regardless, maybe the shoulder, whatever it might be, your back, and it's just too sensitive to respond to any kind of conservative treatment, any kind of therapy. You may want to consider getting an injection to calm things down and then addressing the cause or the source of that irritation, inflammation. Okay, and then number three is if it's just kind of stuck and it's not really going anywhere. You've tried conservative care and it's just still not responding appropriately. Sometimes getting an injection, getting that chemical reaction going on can be enough to kind of cut the symptoms, break that pain cycle, reduce the inflammation, and then allow you to continue with the conservative care. So those are kind of the three main reasons why you might want to consider getting a cortisone injection. I will say, consult with your primary care or orthopedic doctor first if you think this might be an option. I always think that conservative care, physical therapy more specifically, is kind of step number one. Because that's what I do best, and I think it really works well for most people. And then, so that being said, I think that dry needling could be a prior step to getting an injection, right? So their big reasoning behind getting any kind of invasive technique is for that needle to actually go into whatever area might be affected to basically kickstart your body's ability to heal. Okay, so you're kind of provoking a controlled inflammatory response that your body then recognizes and starts that cascade of recovery and healing responses that it typically would with any kind of injury. We're just kind of boosting that and helping it and reminding the body that, okay, we got to go complete this cycle of care instead of getting stuck, which can happen sometimes. So that's why dry needling is nice and effective. The needle is a lot smaller. We're not injecting any foreign substances. We're literally just creating a lesion to the area, to the tissue, to the joint, that space, to again do what I just talked about. Okay. And other things that we need to consider are, time, the kind of timeline of events. So, if you're an athlete who has a deadline of a game or some kind of event that's coming up, you might not have time to go through the conservative measures of PT, a true course of physical therapy. And, you hear about athletes getting injections and then returning to play pretty quickly. There's definitely most likely a heightened risk of re-injury at that point if you haven't really corrected the issue. So that's something you have to be aware of. But if you're going on vacation and you just don't have time to go through therapy and you just need to get rid of that inflammatory response or the pain response, then again, yeah, maybe that injection is appropriate, but we want to keep in mind that we should always be following this up with some kind of rehab care, PT care, unless it was just pure, a traumatic event, you fell on your shoulder, and that just impact caused an inflammatory response, and maybe that wasn't enough time to actually develop true dysfunction in the joint, loss of motion, impaired motor control, and the quality of movement maybe didn't get impaired, right? So that's maybe the only circumstance that you can probably get away with not going to therapy and not addressing things beyond that inflammatory process. So yeah, that's kind of my take on injections. There's obviously a lot of different types of injections now. This is kind of purely just on a traditional cortisone injection. There's PRP injections. They have cartilage replacement gel injections, things like that. But this video is not going to talk about that. And again, if you have any specific questions, you definitely want to consult with the provider that's going to be giving you the injection. Physical therapists do not give injections. The most invasive thing that we do is dry needling. And yeah, so if you guys are interested in dry needling, feel free to comment on that or direct message. Thanks for watching. Make sure to subscribe to the channel, hit on the bell to get notified, and of course follow me on Instagram as well at MG Lifestyle Solutions, and check out the website. Okay, thanks for watching, and I'll talk to you guys soon.